Morning, Caroline. How are you?
Morning. I'm good, Mike. How are you?
I'm not too bad. The second session in quick succession.
I
Thank you for
know, I know. And the last time we met, the sun was shining and now it's snowing. And I look
uh,
out the window.
the typical March in the Northeast.
I know, I know.
Indeed. Um, so today the idea was that we were going to catch up on a few of the questions that we didn't
Mhm.
get to last week. We've actually had quite a few since then, so I'm hoping to squeeze
Good.
some more in. But before we get started, I know there was quite a few questions, the most we've ever had on a single topic actually, about mileage expenses last week and the annual mileage cap. And I know you've taken some action since we last spoke. Are you able to share any of those details with us just now, Caroline?
Yeah, as you will have seen from my response, Mike, when you asked the question, I was really clear that we had to be fair, and so I needed to go and understand the issue in more detail than I did when we spoke last week. So I have. I've had a discussion at the board chief execs, which is when the board um, chief execs from Scotland come together, and this is an issue across Scotland, not just for Grampian. And there's my front door. There's the joy of working from home, but thankfully the dogs haven't responded to that. So I've taken it to the board chief execs, and there is a discussion that's going to happen around what we can do. As I said in our conversation last week, Mike, this is a national, it's national T's and C's, it's a national decision, but there's also a UK element to that, so it's slightly more complex. But we are going to take it through and understand what we can do. At a more local level, I spoke to Tom Power and Alan Sharp from Finance. So Tom, our Director of People and Culture, Alan Sharp, our Interim Director of Finance as of tomorrow. And they have agreed locally what we need to look at and connect into the national work. So Tom brought this to my team meeting on Tuesday. We had a conversation about it, and he is going to prepare a brief to go in, the daily brief, just to update colleagues on where we're at. But our intention will be to ensure that the approach we take is fair and acknowledges the challenges that colleagues raised with me last week. I think the other thing that Tom shared with me, which I didn't quite understand, is the added pressure of the reduction in rate after 3,500. The button will reset from the 1st of April. So that will be an immediate fix around that. But we need to look at, particularly our colleagues working in remote and rural areas, how we support them fairly in the future. So I would hope, if not today or tomorrow, Mike, we can get something in the brief around that.
Okay, thank you, Caroline. That's helpful to know, and it's something that people feel strongly about, quite rightly. Just before we crack on with the questions, I think some people may have seen this in the brief, but I know there's been some progress on hot food for staff. That's obviously been an issue that we've been asked about quite a few times. Is there anything you can share for people who haven't seen those updates?
Yeah, I think that so this became a real theme, and it was something that had been highlighted before. And so I'm very grateful to catering colleagues who have progressed this work. So it's my understanding, Mike, that we now have a range of vending machines that are providing hot food, and they are available across our sites. I think we've still got more to do, but I know that you've put the specific sites in the brief, and I think Dr. Gray's is the one that's coming online next. So I think that will be part of the solution, and let's see what people feel about that, how that works. Of course, relating to the conversation last week, we've got to get people to take breaks. So I think it is a bigger issue around being able to have access to food and fluid, and then taking breaks. But huge thanks to catering colleagues. Let's see how this lands and if this works, and we can reassess it. But one of the conversations, if you remember, I said this is slightly more complex than I had imagined, and that complexity is something that the catering team have really tried to work through. and of course cost comes into that, and we need to work out how we can make sure that what we do put in place meets the needs of colleagues that are working out of hours, but also is affordable, and that we can continue to provide it. However, I will restate that making sure we've got the fundamentals right in how people experience working in Grampian, and food and fluid and breaks and going to the loo are all part of that. So work to be done, but a really good start.
Thank you, Caroline. That's really helpful. Okay, so I think we've got quite a few questions today, as I say, so I'll crack on with that. The first question comes from Dr. Matthew Newman, who works in general surgery. He asks when NHS Grampian will start accepting work experience placements again. He comments that given staff shortages, it's more evident than ever that we need to be actively recruiting a next generation of doctors and nurses, and those work experience placements are integral to that.
Yeah, so thanks, Matthew. Completely agree that a positive work experience placement can really influence people to join us in a range of professions. I presume we stopped it because of COVID. However, I'm going to cut this short and not waffle by saying I don't know the exact answer, but I will ask Jerry Laurie, who works in Tom's team, to give us an exact answer to that. And I would hope that as the restrictions around COVID are reduced, that we do that as soon as we possibly can. But I will ask Jerry to give us an exact answer. But please know that I recognise the importance of this and the difference it can make. One, to us in trying to recruit and attract people, but also to our young adults in Grampian, and how difficult it is for them to get accepted into places if they don't have work experience. So really important from both fronts.
Thanks a lot. The next question is from an anonymous staff nurse. She comments that there are many retired nurses have returned to NHS Grampian during the pandemic, and have committed to staying on by accepting contract offers. The pension benefits offered during the pandemic for retired nurses will only be extended to October of this year, and the colleague is concerned that when these benefits expire, those nurses may choose to leave or reduce their hours. The colleagues asked what steps NHS Grampian are taking to secure these benefits or fill the gaps potentially left behind if these people do choose not to stay on. Is that something that you're aware of?
So no, Mike, if I'm honest, it wasn't a specific thing that I was aware of. However, what I am aware of is exactly as our colleague has raised, there is going to be a gap that is created from colleagues that chose to come and work with us during the pandemic, and very grateful for that. And I think one of the challenges, particularly, as I've said before, for people in health and care, as the rest of society gets back to normal, health and care feels under more pressure than it ever has, and therefore the need for an appropriate workforce. So pensions are again a national T's and C's. It's a national piece of work. So we don't have the influence around pensions. The position that was taken during the pandemic to encourage people from retirement to come back, I don't know the detail of that, but as I've said before, Lorraine, who again works in Tom's team, could give us specifics. In fact, that reminds me, were we not meant to do a specific Q&A with Lorraine? So that might be, we are doing one. So maybe we could pick it up in that, or I could get Lorraine to do a wee brief just on that. So that's one part of the question. The next part is the question is how are we going to manage the consequences of further reducing our workforce? And so lots of things, I've spoken about them before, but redesign around how can we do things differently, how can we attract new colleagues, international colleagues, just in relation to the question I just answered about how do we get school leavers to be thinking about coming and joining us, and working very closely with the universities and college to make sure that we do that well. And then really importantly, how do we retain colleagues that are already in our system? So how would we encourage people to stay? And for me, as you know, that's about how you experience work and how valued you feel and how respected you feel. And that's the big cultural piece of work that is underway and I've spoken about before that Tom is leading on.
Thanks, Caroline. The next question's very similar. It's again on workforce-related issues. This comes from some colleagues, some anonymous colleagues in the acute sector. They have asked, since 2018, we've obviously been recruiting graduate nurses from Australia. They've asked if you know any details of how many people we did actually manage to recruit, if that's still ongoing, and how many we anticipate to still be in post this year. Are you aware of those details, Caroline?
So at a pretty high level, Mike, I am, but so I would suggest that Jane Ewan, who has been around some of the leadership of this since 2018, she'll be able to give us the exact numbers. And I'm always aware of how much interest is generated around those numbers. So I wouldn't like to get them wrong, but I will give kind of my thoughts on where we got to. So Australia was on a number of levels a really exciting venture, and we first made contact with Australia in 2017, and then from that more generally focused in Western Australia and working with the government there, which was a really productive piece of work. So I think overall we probably ended up recruiting, I'm going to say around about 60 whole-time equivalent graduates who came and worked with us for the duration of their visa. Usually that's around about 2 years. COVID definitely impacted on that. So as many of you will know, because I know that you've worked with our Australian colleagues, they were predominantly young adults in their 20s and who travelled to the other side of the world. So the impact of COVID and wanting to be back with their families and the restrictions that you'll know that have been around Australia were significant. So that definitely had an impact. And I couldn't see how many of them are with us. Jane will tell us that. But I know that we have another 27, because the restrictions are now lifting, that are starting to come back in, and they are in what we would refer to as, sounds a bit derogatory, but refer to as the pipeline. So the recruitment of visa and all the onboarding stuff. So I think 27, and I know that because I read a paper about it yesterday. But probably an important thing to use this opportunity is to share the much wider international recruitment that we are now underway with. And I would be as bold as to say leading the way in Scotland around this, would be that we put out an international advert, and there were over, I think it was around about 200 applicants. Which I know from that we have around about 30 Nigerian colleagues coming to join us, and they're just going through the complex process that is international recruitment. We are also trying something different, which is working with a specific agency who focuses on ethical recruitment, and which is really, really important to me and to us. And we have a contract with them to bring over to Grampian around about 40 registered nurses from a range of countries, the UAE, Nepal, India, and so that's something new that we're trying. So yeah, we'll get you the specifics on Australia. Any of you that have worked with the Australian team, they were just a delight, Mike, absolutely brilliant colleagues to have in our system. and Jane will be able to provide us the specifics, but our learning from that has allowed us to really expand the scope of international recruitment. So look forward to seeing the output of that and how we continue with that, because I think it's really important work.
Yeah, those are awesome figures. It'll be great to see them actually spelt out in the brief, but it should make a difference, I'm sure. Okay, the next question is again from a nursing colleague. They've asked if it's possible to have cold water for staff to be able to drink during shifts in wards, in wards 206, 207, 208 specifically. They've commented that water is appreciated and supplied during the summer months, but not in the winter, and the difference that easy access to water makes for colleagues is huge. They've asked if that's something that you would be able to help with.
So on the face of that, of course, the answer is going to be yes. What I need to do is I need to speak to Paul to understand why that's a problem. I know that the drinking water in some of our areas, although safe to drink, is warm, and none of us want that. So I will say it again, we have to get the fundamentals right: food, fluid, breaks. So let me understand what we need to do, and you'll be delighted to hear that I dropped Paul and Tom actually a wee email to say, recognise my Q&As tend to predominantly come to you. I'm sorry about that. But they now have colleagues in their teams watching these to say, right, what's she going to ask us to do now? So so they'll probably come back to me. Chantel will probably come back to me with that before I get to her. But let me work it out. We need to work out specifically what the issue is in those wards, and there might be a wider issue. So I'll get the right person to get in touch with colleagues in surgery around that, and we can work it out.
Yeah, it's funny you mentioned the taste. The part I didn't read out of the question was the colleague actually commented that the water may be safe to drink on the wards, but it just tastes awful. So
yeah,
I think,
and that, I mean that's not right, is it? So yeah, and this is about, you know, this is about us changing to be an organisation that truly puts our colleagues at the centre of what we do, and let's not deal with the really fancy stuff. Let's get the fundamentals right first.
thanks, Caroline. The next question comes from Liam Buchan, who is a healthcare support worker in the Mental Health and Learning Disability Service. He says, basically, as the healthcare support worker role continues to grow in clinical settings, will there be an opportunity for the banding of these roles to be reassessed? The context around that for him is that there is a feeling amongst his colleagues and his nursing colleagues that band 2 and 3 healthcare support workers often complete the same work to the same standards, and the feeling is that they should all be rebanded as band 3 posts. Is that something that we'd be willing to consider or are considering?
Liam, so this is going to be a great answer, and unfortunately it's nothing to do with me. But yeah, so there's been an absolute national recognition of Liam's point, and I know that June Brown, our nurse director, is working with colleagues around exactly that. So there is a national, that's what I'm saying, it's not I can't take the credit for this, but there has been a national agreement that across Scotland we need to recognise the huge contribution that our healthcare support worker community contributes to health and care, and that we will be reviewing all of those roles and making sure that the job descriptions meet the skills and competencies of a level 3 practitioner. And I don't know the finite detail or the timings, but my understanding, I hope I get this right, is that we will then move to a place of the majority of our healthcare support worker colleagues being graded at Agenda for Change Band 3 and working at Level 3. There's quite a variation, Mike, in the role of healthcare support workers across Grampian. I had a great conversation with some colleagues in orthopaedics a few months ago, and they were just delighted with their roles. They'd extended roles, and they were hugely motivated by that. And then I speak to other colleagues who feel pretty frustrated and underutilised. So June's work is to try and get some consistency, and then truly understand what it is that colleagues at that level 2 will do, level 3, and then really importantly, we've got a huge gap around level 4, band 4 Agenda for Change. So June is looking at that as well. So really looking to create a career pathway. But Liam, what I'll do is I'll ask June to get a bit of a timeline into the brief around it. And the associate practice educators should know this too. So speak to your associate practice educator in mental health, and they will help your understanding around what needs to be done.
Well, thank you. That's big news for our
Good
healthcare
news.
support workers, indeed. Thank you. So the next one is a couple of different colleagues have been in touch about the future of research in NHS Grampian. One of them comments about the developments that came around vaccines over the last couple of years, our participation in a number of studies during the pandemic, illustrating the importance of research in the organisation. What they've asked is, both of them have asked, as a board, do we plan to maintain our commitment to research moving forward, especially if budgets are potentially squeezed or operational pressures continue to have such an impact?
Yeah. So research is critical to our health and care system, and actually for colleagues that are immersed in research as their predominant role. I recognise it's been a pretty frustrating time, although as you say, some good work has come out of that. So yeah, the board, so I am very committed to research, and I know that the board are too, and I know that across our executive team, so Nick Fluck and June Brown, Susan Webb, Adam Caldwell's are all very interested in how we maintain a real presence around research. And it's there for different things, for different professional groups. So working with Robert Gordon's University and the University of Aberdeen, actually there's really important collaboration and development of clinical academics and research. So we're committed. We have acknowledged that with education and research, both of these have been significantly compromised over the last 2 years, and that's been hard, and I don't know how we could have avoided that, to be honest. So we are absolutely committed to it. We have a number of enthusiasts around the research agenda. We have formal partnerships, we have collaborations, and I look forward to seeing that work, particularly multi-professional. So our medical colleagues have been very heavily involved and very public around research. Nursing and AHPs have tended to be less so around that. And so with the introduction and opportunities of Magnet, and the appointment of Debbie Baldy, I know that her role has been to take some of the fear out of research and make it much more real for people. So yeah, some really exciting stuff going on around that.
Well, it doesn't sound like anything's stopping anyway, so
No.
Indeed. So the next question, this, I think Paul Allen might have thought he was getting away with things today, but he won't probably on this answer. So this might be too specific for you to answer personally, but I'll see what you think. It's from a colleague who says that with current data on the shared drive, they have to, if they want to include patient identifiable data, they had to get Caldecott Guardian approval, and they've asked if that would be required with the upcoming move to SharePoint. On a similar note, they've also said that they understand names and CAI numbers can only be sent in email and should not be sent on Teams. That seems to be, why would that make a difference essentially when it all sits within Microsoft 365? Is there anything you can add on that, Caroline?
Apart from, oh, don't know the answer to that. So, however, I do know two people that will. So Paul Allen from the eHealth systems will get one of his team's colleagues to answer that. Perhaps Scott's, I'm not sure, but they'll probably do it jointly with our Caldecott guardian, who is Nick Fluck, our medical director. And I think the ability to share clinical data is something that Nick is constantly focused on, so, and making it easier for people, but clearly keeping people's data safe. And I don't think the importance of that can be underestimated. You will have seen some of the recent concerns around that relating to mental health. So let me get a specific response back in the brief. We'll get something to the colleague that specifically raised it, Mike, if you've got their details, but we'll also put something a little bit more general in the brief, and I'll get Nick and Paul to do that.
The next one comes from a colleague who's anonymous. They've asked, and I think this is something a lot of people have wanted to know. It's about the Culture Matters staff survey, which the period for that is obviously ended. But what they're not sure about is why we need to have both the Culture Matters survey and the iMatter staff survey. They just wondered if you could explain why we needed both and why it's important that people participate in both.
Yeah, so and it's a really valid question, and one that we went round and round the houses on because of the additional ask of people. So what the Culture Matter survey does is provide a much deeper understanding of the culture at an organisational level and also at a team level. And to be blunt, iMatter wasn't giving me what I needed to be able to develop the plans to address the cultural issues that I am told and I see that we have. So we worked, excuse me, we worked with Tom around how can we try and get the timing right between iMatter. And iMatter does give us intelligence, different intelligence, but you'll understand when you see the output from the wider culture survey just how much more information we get and support and infrastructure around making change happen. So both are important. One of the reasons the iMatter one is important is it's a national piece of work. So that allows us to benchmark across Scotland, and from a Scottish Government perspective, that's important, and it's important to understand what that intelligence gives us to shape some of our national thinking. So that's why it's important to feed into that. It also gives us some information at a team level. It depends how engaged the team are in doing it. That's pretty variable. But yeah, you will see the difference when you see the data from the Culture Matters survey. It was a pretty tricky one, and that was one of the reasons it took so long to get the cultural survey off the ground, was trying to time it with the national work. And Tom tried to get, because there was also additional surveys done during COVID, but Tom tried to get a kind of a pass, if you like, on iMatter just to prevent that burden, but we weren't able to achieve that. So both are important, both are different, and I would encourage you to complete both, because actually it's about how do we make this better for you.
Thanks, Caroline. I think this is the last question. So someone has been in touch basically to point out the stairlift at the Alan Downie Unit has been non-operational for some time, which causes issues for both patients and staff. They comment that this isn't great for a unit that sees people with neurological conditions especially, and they've asked, you know, what's the issue with this, and why hasn't it been fixed essentially?
Okay, so I don't know the answer to that, and I'm sorry that that lift has inconvenienced people for so long. I do know that our facilities and estates teams work tirelessly to maintain our infrastructure, and Gavin Payne, I'm sure, will have this on a prioritised task list somewhere. So all I can do is I'll get Gavin to go back to the team at that specific site and just let them know. Sometimes it's the communication piece, isn't it, about why is it taking so long, that drops off the to-do list. So yeah, we have some pretty old infrastructure, that's the reality, and the team, I will just restate, do a great job in trying to keep on top of that. But Gavin can reach out directly and let you know where that is in the waiting list.
Yeah, I think, as you say, Caroline, the key thing for that, if it's been out of order for so long, is that there'll be an issue there. It won't just be been forgotten about. Okay, well, thank you again, Caroline, for taking the time to do this today. And is that Ollie making an appearance? We haven't seen him for a couple of weeks.
Appears to be eating something that it shouldn't be eating, but I'll just finish up here and deal with that.
Okie dokie. Thank you, Caroline. And as always, if anybody has any questions or feedback, if you send that in, it's always gratefully received. And I will see you again. Thank you.
Thanks, Mike. See you later.